Mr. Raymond Porter after decompression lumbar spine surgery, and a week or 2 weeks of inpatient functional movement therapy.
No, not quite. A week and a half.
A week and a half. Okay, Ray, let's see. Now, Ray could hardly walk before his... you could hardly walk, Ray, before you came in, could you?
I had to hang on to something.
He was hanging on to things, and even resting in bed, Ray, you were in pain.
Yeah.
Just resting in bed, your legs were just completely...
Never had any sleep at night at all.
Couldn't sleep. Okay, Ray, so we've really focused on functional movement therapy and the NeuroHAB program. Show us your walking today, Ray, after a week and a half. So he's getting out of the seat, using his arms a little bit. Go for a bit of a walk there. Now, show me a few of the ways that our NeuroHAB movement therapist showed you to walk.
How to walk?
Yeah, show us some of the drills and skills that you've learnt. Yep. That's good, Ray. What about the hip hinge? Let's have a look at the hip hinge. Coming around here. Pretty good. Now, do you think that's an important movement?
Yes.
Absolutely important. And you can feel the muscles at the back of the body working.
Yeah.
The muscles, and you're keeping your back nice and straight. Do a couple more of those, chest up. Don't bump your head. Yep, that's pretty good, Ray. That's very good. Okay, so we can, Ray, we're going to just try to keep these knees a little bit further back. So just try that once more. Keep those shins nice and straight for us. Bloody brilliant, Ray. Bloody brilliant. So if you've got to brush your teeth, or if you've got to put something in the dishwasher, if you've got to bend forward to pick something up off a coffee table, that's how we're going to do it, all right? We're not going to do it the old way where you just sort of lean forward on your knees or round your back. That's going to lead to a lot of inflammation in your back, and that's going to lead to what we call degeneritis, inflammation of the spine, which then causes pain, which causes the tissues to swell, and then you end up getting either disc prolapses or spinal stenosis. And then that squashes the nerves, and then the legs just basically go to sleep and stop working, which is the situation that you've found yourself in. But we've sort of resolved that. How old are you, Ray?
86.
86 years old, and you're keen to get back to work now?
Oh, yes.
You're working full time?
Yes, yeah.
5 days a week?
5 and a half.
5.5 days a week. That's amazing. 86 years old. Where are you working?
Proserpine.
Proserpine. And what sort of work is it that you do?
I'm a plumber by trade, but I don't do a lot of plumbing anymore. I do a lot of irrigation and pump work.
My goodness. Okay, you sound like someone who I refer to as the salt of the earth. The salt of the earth. Well, Ray, thank you very much.
Thank you.
I'm very pleased to help you, and are you happy for me to show this little bit of video footage to some of my other patients?
Yes.
And on our website and Facebook page?
Yeah.
Fantastic. You've done fantastically, and I think it's a combination of the surgery to remove that barrier to good movement, and then following it up with specific movement therapy that gives you this new skill. Yeah. Do you feel like you've got a new skill in movement now? Like, do you feel like more?
For sure.
Yeah.
For sure. Look, I can walk anywhere without touching anything.
Yeah, that's wonderful, and that'll set you up for the remainder of your years. Oh, he's even walking backwards. Even walking backwards, Ray. Don't fall over, mate. Walking backwards is pretty challenging. All right, Ray. Excellent. Stay well, okay?
Very good. Thank you, Doctor.